with presence in over 30 states of the Federation. Be sure to be had. For live coverage of events, we have the capacity to deliver from anywhere in Nigeria and beyond. Contact us now on 0803-471-8550 or 0803-724-9733, 014-533-407.
Our 24-hour news station.
Thank you so much for being there with us. It's the second half of Core Digest this morning, and we're still talking about Ebola, EBOLA, the awareness and the race against time. How much time do we have in Nigeria as a country? And here is a recent report. We have it that Liberia government has announced that it is closing down all schools across the country to stop the spread of the deadly Ebola virus. Some communities would be placed under quarantine as well. President Helen Johnson Sirleaf has said non-essential government workers will be sent home for 30 days and the army deployed to enforce the measures. The number of people killed by the virus in West Africa has now reached 672, according to new UN figures. The BBC's West Africa correspondent, Thomas Fassi, says treatment facilities have reportedly been overwhelmed in the Liberian capital, Monrovia. Some wards have already been filled up, forcing health workers to treat some patients at their homes. President Sirleaf said that Friday, 1st August, would be a non-working day in Liberia to allow for the disinfection of all public facilities. All non-essential staff to be determined by the heads of ministries and agencies are to be placed on 30 days compulsory leave, she added. The U.S. humanitarian organization Peace Corps said it was withdrawing 340 volunteers from Liberia, Sierra Leone and Guinea because of the spread of the virus. 2 of its volunteers had been isolated after being exposed to someone who later died from the virus. Okay, with that report, the question now, our guest Victor Okai, a public affairs analyst, is still very much with us. The question is, if Liberia is taking such steps, should Nigeria not close its borders?
Well, you may not shut down your border completely if you have, I mean, yes, if on account of every little thing you say shut down your border, then it may not make too much sense. Where the problem is the level of corruption that we have in this country and the dilapidation of essential facilities. You know, like if you go to the international airport, for instance, the only health facility there is where they do yellow fever vaccine.
Yeah, you get your yellow card.
In fact, when I went to get mine, because that's the one you need to get now, that's the one that's valid now, they were just going to give it. I said, no, I want a shot. You know what I mean? You know, I want a shot. Don't just take the money from me and then. But you can imagine, what if it was an Ebola vaccine? Just pay and go. You know? So there needs to be responsibility, a sense of responsibility. There must be proper supervision. We need to have an up-to-date medical facility where you have quarantine people at the airport. I don't know what they call it, what they call it is quarantine. But we're talking about actually plants, animals, and things like that. All they do when you come, they're checking your baggage. Is like all they're looking for is Gary, something you are taking out, not even something that you're bringing into the country. This fish, where are you taking it to? I mean, I see that. I don't take fish out myself, you know, and all sorts of things like that. And then they will either want to take it to use for themselves or collect money from you, which is a shame, really. Now, services like that are supposed to ensure that, I mean, recently I was reading, someone reported on Facebook about how someone was taking some giant African snails, I think from Nigeria here to the US, and they were confiscated. Obviously, he thought it was like just anywhere. You cannot introduce any species into into that country like that. But here, anything goes. This is why you have, what do you call this? This water hyacinth that was introduced into our waters, because we don't control our borders. We don't control what comes in. People can bring in all sorts of things, from importation of all types of, let me use Tokumbo, for instance, as, I'm sorry about this. Sorry. Tokumbo, for instance, vehicles that people come to dump in our country. You know, not just vehicles, all sorts of things, from refrigerators that have been abandoned, televisions that are antiquated. You even see black and white television from way back that are being brought into the country. Okay? Now, in the same vein, you find that foodstuff, plants, things like that are being introduced into the country. Nobody bothers about them. So what we should do is look at our borders, for instance. Seme, rice, okay, fine, it's good. Rice may be banned, don't bring it in, some contraband. But beyond that, there are so many other things. In each of these, in Seme, do we have a comprehensive, what do you call it now, health facility there? If someone has Ebola, like what happened at look at first, the hospital now in Obalende has been closed down. That was totally, I mean, now there's going to be lots of business. I don't know if government is going to compensate them. I can imagine how much they're losing every day. And the fact that they are now stigmatized, I don't know how they're going to be able to rebound after what has happened. If in Murtala Mohammed Airport there was a comprehensive health facility with an area to quarantine, you know, people like that, you would do that immediately. At the borders, all our borders, not just Seme here, Idiroku, up north, our Cameroonian border, and all the borders with Chad, Niger, and all that. If we have comprehensive health facilities, when things like this happen, you can stop them at that point. Okay? But if you just close the borders for the sake of it, or because Liberia is taking some severe actions and things like that, I mean, you're going to cripple the economy, not just of Nigeria, but even of your neighbors, you know? And our government officials are interacting with people from these countries every day. They hold ECOWAS meetings. Who says? That man is high profile. If you look at him, he's a fine guy. You saw, I don't know if you saw his image, clean, you know, healthy looking gentleman, very handsome man, you know, he's very well to do, you know, and if you saw him ordinarily, you would never, just like HIV, you would never know that he had Ebola. Where could he have contracted it? Where could he have contracted it? But he did, okay? Now, if you close down your borders, your government officials who are interacting with them every day at various international fora and all that, they will come into the country. All you get is yes, sir, at the borders. They come in, no one checks them. That's another Ebola, you know, another Ebola victim gone past your borders. So we should not just victimize people, because in the end, it's only, they will use it as an opportunity again to make money. Put health facilities there, enlighten people there, and let there be places where you can quarantine victims if they are noticed. And whoever is going to be there must know the signs. You know, if we do that, I think it's more effective than to say close down your, okay, for how long will you close down your borders?
So what's the impact of this strike on this disease, the spread of this disease? Doctors are on strike. And even before now, ours is a country where we treat ourselves. We buy over-the-counter drugs. And you feel somehow, you feel this must be malaria, and someone tells you, go get this drug, and you get it. And we have been told that these symptoms, the Ebola symptoms, are just like that of fever and malaria. So what is the impact of all these, especially the doctor strike, on the spread of the disease?
It is sad that we have, and I make no apologies about this, a selfish set of medical doctors, general. Not everyone is individual, because I'm sure not every single one of them is in support of what's going on. But the current people at the helm that have called for this strike have acted rather irresponsibly. Nothing in everything they've demanded for, as far as I'm concerned, has anything to do with our own well-being. It's just themselves. That's all. They're looking for power. They want to oppress other sectors of the medical community. But be that as it may, well, this happened after the strike. So we would not say they were aware and then yet they went on strike, you know. But even when they are on, if you have seen the way they treat people with infectious diseases, especially in government hospitals, we talk about HIV and all that. When you see the way sometimes these doctors and medical personnel treat them, you begin to wonder whether it is not better to sit at home and receive the love of your family and just pass on in the midst of loved people. I mean, loved ones. You know, the strike itself is no doubt it's going to have an effect, because if that victim had not gone to First Foundation Hospital, a private medical facility where you had good doctors who were able to detect it, if you go to public hospitals, nothing would happen. If it was one of the smaller hospitals where all they treat is just malaria and they don't care about whether, you know, that would have happened. So it has a debilitating effect on what government is generally trying to do. For one, if a victim passes through right now and comes, you know, the government hospitals, whether we accept it or not, have the best facilities, both for diagnosis and for treatment. The specialists are all there. You know, you find them in the teaching hospitals and in the government hospitals, hematologists, and all the specialists you might require for diseases like this. You find them in the government hospitals. So at a time like this, it endangers the rest of society. And I don't know how the state governments or what they are doing, particularly let's say in Lagos, or what they're doing to take care of this, but the doctors that are not in the hospitals, if they can be, you know, if they can be active, it probably would help. Or if there's a way they can take care of it, because it will just bring a big minus to whatever efforts the state commissioner is trying and the state government is trying to put in place. The private hospitals, very few of them are adequately equipped to be able to isolate the virus, to be able to detect the virus and know that for sure this is what it is.
Thank you. We talk about the situation of things. Someone earlier mentioned the issue of public places like hotels and public buses. Do you, a particular lady, even in the studio when we went on break, was saying she was in a bus yesterday and, you know, they were all jammed together and she was sneezing, coughing and all of that. How can we handle that? Because you scarcely take a commercial bus in Lagos and you don't get a scratch or your clothes get torn or something. How do we manage that as Nigerians?
I said it in the beginning and I'll say it again. Enlightenment, enlightenment, enlightenment. Because if you don't know, I mean, if for instance, if you know, I mean, if there's enlightenment, you want to sneeze, please cover your mouth properly, okay?
But I want us to break this down and be realistic.
Yes.
I know about this Ebola virus.
Yes.
I know the things to do and not to do.
Yes.
But the structures, are they helping me? Can I say I want to go without being jammed? I don't have a vehicle. I have to take the public transport. And you know, Lagosians, you say, please don't sneeze at kilo share, kini problem. Well, you know, like, how can you manage that?
Okay. Maybe we're going to the extremes here now before we begin to say things. For the records, I'm not a medical doctor.
Yeah.
So, but I do not think that just sneezing would cause it. I do not think that just coughing would cause it. We listened to the expert, and he said, unless someone is vomiting, if sneezing was enough, he probably would say it. But if I'm sneezing right into your face, into your nose, probably, okay. But if I'm not, then I don't think it's that bad. I think we must also be careful about the issue of stigmatizing. You know, there are levels we push it to and it becomes ridiculous. It's bad enough, it's deadly, it's fatalistic, you know. But, you know, like what happened in the initial days of HIV, where it's like, I mean, you couldn't even touch a victim for fear that, you know, so our public transport system is such that it's difficult to avoid it. But I do not think that the BRT, for instance, is that cramped. You know, you can sit, although at peak periods it could be a bit, because when people stand and all that. But what can you do? That's what you have, and that's what it is. You know, so we just have to. If you really feel you must, then put on the face mask.
Seriously. Okay, let's talk about the issue of cremation.
Yeah.
And our culture in Nigeria.
Yes.
Who or which Nigerian would allow the dead or his or her dead to be cremated?
Quite frankly, I can't even, I won't feel it when I'm gone, but I can't imagine what it's like. I'm feeling a bit squeamish now. Imagine what it's like to go through that furnace. You know, culturally, it's strange to us. The Lagos State government has a crematorium. I don't know if they've created sufficient awareness, you know, to make people embrace it as, was I going to say a way of life? As an alternative to burial. You know, maybe they need to enlighten more people, but I doubt that a lot of people, you know, people still want their own bury, you know, after, after the dead have passed on, they still want to come and do whatever. Of course, you can do it even without the body being there and all that, but maybe there's a need to create more awareness about, you know, the benefits of cremating people, and there needs to be, it's a cultural thing, and it's going to take time. This is change that won't come too easily. What happened to that Liberian? I doubt if an average Nigerian would have accepted it. You know, a Nigerian family would have fought that. Fine, it was in the public interest, but it would have been difficult to accept for any other person ordinarily, you know, to say, okay, they will cremate your person because that happened. They would rather say, no, give us the body and let's worry about it, you know. So, but maybe there's a need to begin to, it boils down to the issue, enlightenment. You know, the government policies without proper enlightenment, adequate education will not succeed. The two have to go hand in hand. You know, the media and other forms of public enlightenment. Medicine will not succeed without enlightenment. Governance will not succeed without enlightenment. Whatever we do, there's a need to create awareness.
Thank you. And rounding off now, talking about the limitation of flights. On Monday, we heard about the delays, people stranded at airports, people who wanted to go to Monrovia and all of that. Airlines saying we're not flying this particular place, and people had to cut short their journeys. First, you already mentioned, just like closing borders, the economic impact on the country, but minimizing flights and cutting off flights from some areas, what would that do for us?
You know what I said earlier about driving people underground? If a man has serious business, if a Liberian has serious business in Nigeria, you can stop him in the air, you may not stop him on the road. What will now happen is they would come by road, through the borders, where you don't have any adequate medical facilities, and it can even be more dangerous for us. If you bring them in flights, usually you fill forms where you're going to, your name, where you're coming from, where you're going to, your contact address and all that. Those cards. New measures like that can be introduced so that people can be traced, okay? If you do that and introduce them in flights, then when people land, you can monitor them for a while. You know, but to just shut down completely, well and good, but what you'll find is a situation where you would have driven people underground, you will drive them through routes that you can no longer monitor them. Now that's even worse.
Okay, I want you to talk to people. I know you've said a lot about not stigmatizing people. How can I be, if God forbid, if I know someone next to me now has Ebola virus, how am I supposed, what's the consciousness I'm supposed to carry? If I'm not to panic, if I'm not to move away from the person and isolate that person, what am I supposed to do? I want to help. At the same time, I don't want to get Ebola virus. And in addition, okay, maybe you should answer that first before I go to this last one.
Well, I'll keep saying show love because it could have been you. It could be anybody, okay? And then if you show love, the person will cooperate with you. They will understand. Tamedun, before I'm accused of using the word Lagbaja too much. Tamedun, or Charlie, as a Ghanaian say. This is the situation. We will do everything we can. We're doing everything we can to help you. There's hope. It's not the end of the world. You invite the medical persons and let them know how it is transmitted and that you want to help them. For instance, if you're cooking food, if you prepare food, they have their own plate. They understand. You go there, you give it to them. Even where you wear a mask, tell them it is well, the popular lingo, that you love them, that you appreciate them, that this is going to be fine, and you're doing everything possible to help them. As you do what you do, whatever measures you take, do it, add a bit of love, add reassurance to it, okay? But take the precaution nonetheless, okay? If staying in the same room does not necessarily mean that you're going to get it, you make sure that you're properly kitted, okay? But as you do that, you don't starve them to death, okay? You don't push them away or try to kill them before they actually die. Treat them with some dignity. Anybody would show understanding if they're in that position. They would know. And that's what we need to do. We need to do more of that. Health personnel, do the same thing. Your tongue must be seasoned with salt. Treat people with love. Let them know you appreciate them. Let them know that it could have been anybody. It is unfortunate. However, okay, even when you dress the way you dress like a masquerade, let them know that you're also doing it in the interest of other people, okay? And that you're doing it, that if other people had done that, it would not have happened to them. You know, if you let them know that if measures like this were in place, it would not have happened to them, I think that it would be a lot better. And, you know, people won't feel so bad. I tell you what, if you treat a man or a woman badly, they can get back at you. You see cases where people spit into people's food or do things deliberately. They will do it and get back at you. But if you show them love, even they will say, no, don't bother. You know, they will show understanding. So love begets love. We need to show love. We need to show understanding. We also need to take precaution.
You know, we get our slangs, our street language from anything and anywhere. And Ebola has been added to the chains of slang we have. You have traffic, you have slow movement, you say it's Ebola traffic. Someone annoys you and you say it's Ebola attitude. And, you know, even over the radio, in the media, you have people make joke out of it. Will that help in anything, making it look light?
No. Well, lightening it, making light of it, may just be to humor ourselves, but I think it's much more serious than that. And it should be treated with... I was listening to radio as well yesterday, a talk show on a radio station, and they were cracking unnecessary jokes. Now, that was an opportunity to enlighten the public about signs, symptoms, what to look out for, and what to do. But they were cracking jokes over it. Now, I'm not saying you treat it like, you know, put on a strong, serious face, and no, that's not what I'm talking about. But use every opportunity. We're here talking right now. We have a duty. If you're in the media, you have a duty. If you're wherever you are in your community, you have a duty to spread information about it, enlighten people. It may be saving lives, even your own life. Okay? Tell people things like wash your hands after every encounter. I mean, we're here. I'm touching this. Somebody who is infected may have. I'm just giving my way of example, of course, it's not that. You know, so wash your hands at every opportunity. If there are sanitizers you need to get, use them. You know, tell people what signs to look out for and that they should go to hospital as quickly as possible. It is not said that Ebola kills 100%. They say the chance 50 to 90% of the victims die. If you get proper enlightenment and you go early enough, you might be among the 50% that survives. If you go a little later, you know, you might be among the ones that don't make it eventually. So if people know, they come out early, then they get treated, okay? We expect the cooperation of the health authorities, the government also, who should not also help in stigmatizing victims, and love from family and community. And I tell you, we'll weather the storm that is yet to really come. I hope it doesn't come. But more importantly, let's not forget please, can you do the public, can you help the public by mentioning the community? No, really. So people know, and the government will be aware as well, where bats and palm wine is a delicacy. You will do the public a word of good.
Definitely.
Where is that, please?
Okay, now interviewer.
No, it's important.
Okay, yeah, definitely. First, I must thank you for your time. And secondly, it's not an interior part, it's Ife. We all know exactly, yes. Because you have OAU having the largest concentration of bats in West Africa. Yes. Yes, they actually migrate. It's seasonal. Yes. So I think basically it's about, like you said, yes, it's about enlightening the people. Yes. Washing your hands constantly. We had the Commissioner for Health in Lagos saying that constant washing of hands, yes, with soap, yes, would do a lot of good. Yes. And also, we must note that until the person begins to show symptoms, critical signs, this disease is not contagious. When it's still in its very primitive stage, very low stage, you cannot possibly contract this Ebola virus. So, like Victor Okai said, do not stigmatize these people. They are fellow human beings. It could be you, it could be me, it could be you and I. So if we find someone with this virus, it is not for us to just lock them up in a place and just tell them to die wherever they are. Let us show love, because you know what? Love does a lot of good. It can actually heal people because they get enough strength to fight whatever disease that they have right now. It's been a wonderful time with Victor Okai. I hope the next time when we call on you, you would answer us. I will. Government, please watch Ife and help the people, enlighten them there. The bat and palm wine delicacy, they should just... Definitely, yes, right, definitely. Yeah. Thank you very much. And that's it on Core Digest this morning. Tomorrow is another day. I am Ebulomo Adekunle.
Core TV News now provide a platform for live coverage of political rallies and electioneering campaign from anywhere in Nigeria. Political news stories, political editorial reviews, political discussions, personality profile, People's Parliament from the National, State and Local Government Assembly. Contact us now on 0803-471-8550 or 0803-724-9733. 01453-3407.
Our 24-hour news station.